my name is Amy and this is my intradermal video. So to start off with, I'm going to need some gloves, hand sanitizer for my hand hygiene, alcohol, gauze or a cotton ball, my patient, and medication, which is tuberculin in this case, and a needle with a syringe. So this is a 1 ml syringe with a 25 gauge needle that's 5/8 long. And we're going to go ahead and just verify the provider's orders. So we're going to be doing a TB skin test. So that's 0.1 mLs that we're going to be injecting at the forearm to get a blub or a weld. So we'll first start off with identifying the 6 rights. So right patient, right route, right dose, right time, right documentation, and right medication. So just make sure we have all those rights in place. And we're going to head to the patient's room, close the window, door, give the patient privacy and curtain if needed, just to give them their privacy and introduce ourselves. So my name's Amy. I'm going to be doing your TB test, and I want to verify the patient's name and date of birth and kind of start to explain what we're doing. So we're doing the TB skin test. This will tell us if you have tuberculosis. So what we're going to do is we're just going to inject a small little amount under your forearm and the skin area and kind of get a little bulb or weld. So that will tell us if you develop a reddening spot, if you have tuberculosis or not. So some side effects to watch with tuberculin is rash, shortness of breath, dizziness. So just kind of want to make sure any anaphylaxis is not going to happen. And we're going to go ahead and prepare the needle here. So I'm just going to go ahead and put my hand sanitizer on. And put my gloves on. And grab my first alcohol wipe, and we're gonna just make sure when we check our bottle, just because this is a multi-use vial, so you want to make sure you know what date it was opened and that it's not expired. Also, if you're just opening it, write the opening date. So we're just gonna clean the top with the alcohol and open up the syringe and needle. Perfect. And we're just going to go ahead and draw up the 0.1 mLs. And I'm going to start by adding some air in, and then inserting that into the bottle, and inserting the air, and then drawing up to 0.1. So kind of right there, if you can see that. Perfect. And I also like to just check the needle to make sure there's any abnormalities with it. And then also just make sure I get out any air bubbles. Okay, and then I'm just going to kind of slide this up without recapping it as I set that down for a second to clean the patient's skin. And we're going to go in a circular motion to the outside. And let that dry for a second. And at a, with the bevel up and at a 5 to 15 degree angle, we're just going to go right under the skin here and go ahead and slowly insert the fluid to get the bulb, and then go ahead and remove it. Once we have the bulb, give them a cotton ball or gauze if they need it, and we're just also going to notify them not to cover it or rub it, as that's going to screw up the test, and then return in 48 to 72 hours to have read, and to notify us if he's having any or she's having any of those reactions. And then make sure we're going to cap our needle, put that in the sharps container, dispose of our gloves, perform our hand hygiene again, and document what we did. And yeah, that's it. Thank you.